Welcome to Fila Health Systems of NC, also known as PHSNC. We are committed to providing a safe, respectful, person-centered, and clinically appropriate environment for every individual, family, staff member, visitor, and community partner. At PHSNC, our goal is to support individuals in overcoming barriers, building stability, and moving closer to living their dreams every day. PHSNC believes that every person deserves care in an environment that is free from abuse, neglect, exploitation, intimidation, discrimination, and unnecessary restriction. Our health and safety practices are designed to protect client rights, promote dignity, reduce risk, and support meaningful recovery and long-term success. PHSNC does not use corporal punishment, physical punishment, humiliation, intimidation, threats, painful stimuli, restraints, seclusion, isolation, physical holds, or restrictive interventions as a method of treatment, discipline, behavior management, or emergency response. PHSNC staff are trained to use verbal redirection, supportive intervention, and de-escalation strategies to promote safety whenever concerns arise. In emergency situations where a client's behavior presents an immediate threat of harm to themselves, other clients, staff, visitors, or property, and de-escalation is not effective, PHSNC staff will contact law enforcement or emergency responders as appropriate. Acts of violence, threats, assault, possession of a weapon, property destruction, or other unlawful behavior may result in removal from the program, discharge review, law enforcement involvement, and prosecution to the fullest extent permitted by law. PHSNC maintains a tobacco-free and smoke-free environment to promote health, safety, and wellness. Use of tobacco, nicotine products, vaping devices, e-cigarettes, combustible tobacco products, smokeless tobacco, or similar products is prohibited inside PHSNC facilities, vehicles, program areas, and service-related locations. PHSNC staff may not provide, distribute, sell, or encourage the use of tobacco, nicotine, vaping, or related products to clients. When appropriate, staff may provide information about tobacco cessation support and community resources. PHSNC is committed to maintaining a substance-free treatment and service environment. Clients, staff, visitors, and program participants are not permitted to possess, use, distribute, sell, or be under the influence of illegal drugs, alcohol, unauthorized controlled substances, or misused medications while participating in services or while present at a PHSNC facility, program location, vehicle, or sponsored activity. When substance use concerns are identified, PHSNC staff will respond in a clinically appropriate, trauma-informed, and safety-focused manner. This may include assessment, referral, safety planning, treatment team coordination, guardian involvement when appropriate, or emergency intervention when there is an immediate risk of harm. Clients are expected to use prescription and over-the-counter medications only as prescribed or directed by a licensed medical professional. PHSNC does not permit the sharing, selling, trading, misuse, or unauthorized possession of prescription or over-the-counter medications. Clients are responsible for maintaining possession of their own prescription and over-the-counter medications while at a PHSNC facility, program site, or service-related activity. PHSNC staff will not store, hold, secure, administer, or keep medications on behalf of clients. Any medications brought to the facility must remain in the client's possession and must be used only as prescribed or directed. Medication-related concerns may be referred to the appropriate clinical, medical, or emergency provider for review. Weapons and dangerous items are prohibited at PHSNC facilities, vehicles, program sites, and service-related activities. This includes firearms, knives, explosives, ammunition, tasers, brass knuckles, weapons used for intimidation, or any item used or intended to threaten, harm, or endanger another person. If a weapon or dangerous item is discovered, PHSNC staff will follow safety procedures, which may include securing the area, notifying a supervisor, contacting emergency services or law enforcement, completing incident documentation, and taking steps to protect clients, staff, and visitors. At the start of services, clients and legally responsible persons have the right to be informed of program rules, participation expectations, safety requirements, client rights, grievance procedures, and possible consequences for violating program expectations. PHSNC program rules are intended to support safety, accountability, respect, therapeutic engagement, and successful service participation. Clients are expected to treat staff, peers, family members, and visitors with respect, participate in services as outlined in their plan, maintain confidentiality, follow facility and group rules, avoid weapons, alcohol, illegal drugs, and unauthorized substances, use medications only as prescribed, protect property, communicate concerns appropriately, and participate in treatment and safety planning when needed. When a client's behavior creates a safety concern or interferes with treatment, PHSNC may use appropriate clinical interventions, redirection, de-escalation, safety planning, supervision, treatment team review, or modification of service participation. Restrictions, temporary suspension, activity changes, or discharge recommendations must be based on legitimate clinical, safety, or program concerns. These actions are not used for punishment, retaliation, discrimination, or humiliation. Whenever possible, PHSNC uses progressive, supportive, and person-centered approaches, including coaching, review of expectations, family or guardian meetings, treatment team meetings, safety planning, behavioral support planning, modified schedules, increased supervision, referral for assessment, or referral to a higher level of care. When privileges, activities, or program participation have been restricted due to safety or behavioral concerns, PHSNC will identify steps needed for the client to safely return to full participation whenever clinically appropriate. This may include meeting with staff or the treatment team, reviewing the concern, updating the person-centered plan or safety plan, demonstrating safe and respectful behavior, participating in recommended services, following agreed-upon goals, and involving a parent, guardian, legally responsible person, or support person when appropriate. Clients have the right to participate in treatment planning, ask questions, voice concerns, and use the grievance process without fear of retaliation. Thank you for helping PHSNC maintain a safe, respectful, and supportive environment. Together, we can protect the rights, dignity, and safety of everyone who walks through our doors. At Pila Health Systems of NC, we remain committed to helping you live your dreams every day.